Councillors, ladies and gentlemen, I'm Councillor Sophia James. I'm the Chair of the Adult Social Care, Children's Services and Education Committee. I'd like to welcome you all to tonight's meeting, which councillors are now required to attend in person, following the expiry of the Coronavirus Act regulations, which permitted online meetings. We are meeting in a socially distanced layout in the council chamber, with a small number of seats provided for the press and the packed out public galleries. We'll be using new equipment connecting the chamber into Microsoft Teams. There was now a live stream which will be available through Teams, and a recording of the meeting will be uploaded to the website afterwards. We'll now ask the councillors to introduce themselves. Okay.
Let me start. Hi, I'm Graham Hoskin. I'm the Lead Councillor for Health, Wellbeing and Sport.
I'm Liz Terry. I'm the Lead Member for Children's Services.
Is that working? No. Oh, okay. Could you hear me? Oh gosh, that's so loud.
I should just explain before we continue that some of the microphones were not charged after the previous committee last night. So all right. We've got handy support with.
I promise I won't sing to you. So Councillor Rose Williams from Catesgrove Ward.
Good evening, I'm Councillor Alison Bufford-Coles from Weekly Ward.
Good evening, Chair. Dayapal Singh, Councillor, Kentwood Ward.
Councillor Aisha O'Connor representing Caversham Ward.
Councillor Ashley Pearce, the Lead Councillor for Education.
Councillor David Abson, Redlands Ward.
Good evening, Chair. Good evening, everyone. Councillor Simon Robinson, representing Peppard Ward.
Good evening, everyone. Councillor Paul Carnell from Thames Ward.
Good evening, Councillor Isabel Baldston, representing Maple Durham Ward.
Fabulous, thank you. We have apologies from Councillor John Ennis and Councillor Rob White as well to add to the record. Okay, are there any declarations of interest? No? All right. And can we have a look at the minutes, please? Any comments on the minutes? And okay, I'll sign them off as an accurate record. Do we have any petitions? No. No petitions. We did have a question from a councillor, however, the councillor is not available, so we'll not be hearing that question tonight. Do we have any questions from members of the public? No questions from members of the public. The question from the councillor will be made available. Understood. The question from the councillor will be made available online after the meeting. We have no decision book references to my knowledge. Okay. And do we have Royal Berkshire in tonight? Yes, we do. Okay, gentlemen, I'll hand over to you to introduce yourself. Thank you very much for joining us tonight.
Thank you, Chair. I'm Steve McManus. I'm the Chief Executive of the Royal Berkshire Hospitals, and really grateful for the opportunity to come and speak to the committee tonight.
Thank you, Chair. My name is Eamon Sullivan. I'm the Chief Nurse at the Royal Berkshire Hospitals. I'm new in post, just over 5 weeks, and my previous role was Chief Nurse in the Royal Marsden Hospital, and I'm a local resident. Thank you.
Thank you very much. Did you have a short presentation that you wanted to give, or?
Chair, no, we've not got a presentation, but we did respond back to the committee set of questions with some narrative that we hope was helpful, but we've also got the opportunity maybe to work through each of the 5 questions that were raised specifically and to take any additional kind of questions or discussion that the committee might want to make. And then certainly if there's anything else beyond the scope of those questions while we're here, very happy to kind of answer anything else as well.
Does that mean you're going to go first?
Yeah, so what I was suggesting, Chair, is that between Eamon and I, we can just maybe summarise the kind of headlines on each of the questions, give a kind of a brief kind of answer, but then maybe just expand on that based on any questions that councillors might have.
That would be excellent. Thank you. Feel free to start.
Thank you, Chair. So I think the invite here to tonight was particularly to discuss some of the aspects of the Royal Berks quality account that was published, and I think again really grateful for the council and the committee's kind of input into that and the questions that were raised. So the first area that the committee raised was around health inequalities highlighted in the report as related to people with learning disabilities, and that being a priority focus for us was noted, and it would be helpful to hear a little bit more about that. I'm going to hand over in a second to Eamon, just maybe to talk about some of the specifics on our focus around residents with learning disabilities. But I just wanted to put that into a little bit of context around, I suppose, some of the commitment of the organisation kind of more longer term to the kind of broader public health agenda and agenda around health inequalities. So it's kind of an area that we've really seen as a kind of priority focus for us at the Royal Berks. One of the things that we've just embarked on is a longer term partnership with our public health colleagues, so working directly with Meriden Peachy and the public health team. So as an organisation, we've committed to invest £300,000 over the next 3 years into a longer term partnership with public health. And part of that will be to look at a joint appointment of a consultant in public health between the public health team and the Royal Berks. That's to really enable us to bring public health kind of expertise and some of the public health capability into the organisation to really better inform us how we support decisions for the local community around the services we're delivering, how we engage further with the local community above and beyond what we're already doing, but we really bring the kind of public health kind of lens into the decisions we're able to make. So really pleased about the opportunity to progress that with the public health team. I think it might be just worth Eamon just pulling out specifically from the quality account some of the areas that we're focusing on around learning disabilities.
Thank you, Chair. So this is a major focus for us in the Trust. So it's one of my own professional interests is care of citizens with learning disabilities and autism. So I've been really impressed by the work that the Trust has done in the last 12 months, in particular, last 14 months really over COVID. So it's kind of building on that work as we kind of are immersed in the recovery phase and then beyond that. So just to touch on a few of the initiatives that the Trust has undertaken, which I have to say I'm enormously impressed with. From kind of day one in wave one, our learning disability team remained in the hospital and indeed working in the community with citizens with learning disabilities and autism. So you can imagine it was very, very frightening time for those citizens, and what they immediately began to do as services were disrupted or delayed, our learning disabilities team kept a very active register of citizens with learning disabilities. So as soon as services reactivated again, we were immediately ready to initiate the care of those patients. So essentially there was no kind of lag or waiting list. That's an enormously impressive achievement by the Trust. We're also then looking at how we train our staff, and we've just about to embark on a very large kind of education piece for our staff. We've won £30,000 worth of funding to produce some innovative training materials for our staff moving forward, and we're going to move that at pace now. So we hope to have that concluded by the end of Q3 this year. I'm particularly interested in 24/7 care of patients with learning disabilities. So it's not, obviously the hospital is a 24/7 service. It's not 9 to 5. So what happens to patients who are admitted or especially vulnerable patients who are admitted out of hours? So again, we're strengthening how we care for people in those vulnerable times when the lights go down in the hospital. We're also looking at wayfinding, how we improve wayfinding in the hospital, and also reintroducing our volunteers as well, and how we can support people with learning disabilities. But the team's done, just in summary, the team's done a tremendous job. But the work doesn't stop, and you know, I think we're kind of judged on how we care for our most vulnerable people, and that's absolutely right. And I guess the committee has got my pledge that I will do everything I can to improve the healthcare of citizens with learning disability and autism.
Happy to take any question. I'm happy to pause after each kind of theme, maybe, Chair, and see if there's any kind of follow-up kind of questions or comments, thoughts, or indeed advice and ideas.
Thank you very much for that presentation. That's really helpful. I'm going to hand over to Councillor Hoskin.
I mean, just on that, I mean, I think the commitment around learning disabilities and addressing which we know there's significant health inequalities, is really welcome, and also we looking to see how that progresses. So really pleased to hear that. Also, actually, just a matter of welcoming. I mean, it was happening, but I think the commitment to increasingly involve the trust in the public health agenda, I think is absolutely the right thing to do, and hopefully also in terms of your plans around the development of the hospital as that develops in the context of a hospital that's very much looking to the community surrounding it and in the overall health of the community, as opposed to not, in the past, a traditional, it's not about the RBH, but traditional hospital, system of just being interested in the people that come in and get them out the door and you're done. So I think that's really good to hear, and I think over time, certainly as a council, we'll be looking to work alongside you with that in terms of the plans and how that meshes together also with the health and wellbeing strategy, which of course you've been involved in developing as well as a trust. So it's not really a question; it was just really welcoming that. Thanks.
No, I'm really grateful for Councillor Hoskins' kind of comments there. I mean, I think just two quick follow-up points. Certainly over the last 4 years since being Chief Executive of the Royal Berks, I'm very clear that we've actively moved away from kind of the terminology about being an acute hospital. We are a community asset, and actually increasingly we should be looking at using the assets that we have to deliver care and support further kind of upstream into the community, as opposed to being the kind of end product of certain aspects of ill health within the community. We still have that role to play, but actually we need to change kind of the way that we're actually using the facilities that we've got much more to move that into earlier intervention and prevention, and hence kind of why I'm really excited about the kind of partnership with public health, because that's absolutely the space that we need to be in. Secondly, the councillor mentions about the hospital redevelopment programme. See that as a really excellent opportunity in terms of what we can collectively bring into Reading and into Berkshire, a whole range of opportunities in terms of what that may well generate. And we are part of what's called the HIP2 programme, so the Hospital Improvement Programme. We're really pushing for the potential to bring that kind of investment into Reading for a potential redevelopment start in around 2025. So over the coming kind of months, it's going to be really important for us to be working very closely with the council on how we really make the most of that opportunity, not just for the hospital, but actually for the wider community in the broader sense.
Thank you very much. Any further questions from colleagues? I mean, whilst we're waiting for questions, I'm quite happy to say that I think the learning disability support particularly is incredibly impressive, and we'd certainly welcome working in partnership with public health. I think it's positive, it makes sense, and I think that's an extremely good element of it. I think you've stunned us all into silence.
Yes, yeah, I think that was only question one, I think, Chair. So question two was really around the impacts of COVID and rehabilitation, and particularly kind of aspects of long COVID as well, and addressing again some of the risk factors of COVID outcomes for people in our population with certain conditions like CVD and obesity. Again, I'll bring Eamon in here in a second, but probably one thing just to frame is that an area that we've been our clinical teams have been very innovative around and working with community teams in partnership is actually about trying to, as much as possible, prevent members of our community getting to the point where actually they have the effects of long COVID. And one of the innovations that, you know, we're really pleased got taken up much more widely across the NHS is something called TIC-19, which was our triage into community with COVID-19, which is where patients coming through into our emergency department with symptoms of COVID, who were assessed that they would be able to be managed kind of at home, were sent home with what's called saturation monitors to monitor their kind of oxygen concentration at home, had daily kind of follow-ups and then ongoing support from the clinical team to actually manage their care at home. And we know that actually outcomes and recovery for people in their own home is significantly improved if you can keep people into their home kind of environment. So really important that, you know, we were able to develop that service, and that kind of service expanded, and we're running now still a virtual service, a set of virtual wards effectively with people in their own home who we're continuing to follow up and support in terms of the ongoing effects of COVID. We've also kind of been one of the early adopters around the long COVID programme at Royal Berks, and that's been a kind of an active collaboration within Berkshire West here as a local place, but also across the integrated care system with partners in the community, with BHFT and kind of with wider partners as well. So it's an area that we're also engaging as an active research, as a research active organisation, and contributing to national research in terms of the impact of long COVID and how we support the ongoing legacy effects that we're absolutely going to see in our community around COVID over the coming kind of months and years. But Eamon, any kind of other specific things that relate to the quality account as well, maybe?
Yeah, certainly. I guess in terms of long COVID, I guess it's probably worth noting that the Royal Berkshire Hospitals was one of the first to set up a long COVID clinic, and over 700 residents and staff indeed have been treated there thus far. It's a very, very fast-paced part of medicine. It's moving very, very quickly. It's largely therapy-driven. I will share my own personal story. I contracted COVID in the Nightingale Hospital last summer and was under the care of the long COVID clinic, and it absolutely can improve both the clinicians who've been affected with COVID and also members of the local community as well. So it really is a really exciting and advanced space of medicine. I should just touch briefly on paediatric long COVID, because of our 700 citizens who we've cared for, 4 have been children, and I'm sure the committee will be interested in that. And the Bob ICS is now consolidating because the numbers are so small, but obviously we don't absolutely know how this will play out. The Bob ICS is going to consolidate, and we're going to bring together this specialty across the whole of Bob to look at it. So we have got an enhanced paediatric service moving forward, and we're ready potentially if indeed the numbers pick up. But there's no evidence of that. So again, this will feature in our work moving forward.
And just Chair, maybe just very quickly, I think it's also really important to recognise that, of course, nationally and locally, the focus has been on treating the significant amount of patients who've come through from our community with COVID, but actually there's a real risk around widening inequalities around non-COVID services as well. So it's something that we've been really focused on as learning from the first wave last year about how we were able to maintain non-COVID services as effectively as we needed to, so as we didn't see that widening of inequalities in our community of people being able to access those other services. So right the way through the second wave, we were able to maintain a significant level of our services for adults and for children. We utilised the capacity around us with our partners in BHFT, but also the independent sector facilities that we had around us, and also the other facilities that we have at places like West Berkshire Community Hospital, Townlands Hospital on the borders of Oxfordshire and Berkshire and our facilities out in Bracknell as well, to effectively create cold environments that were kind of COVID free, that allowed us to really make sure that we were able to maintain as many services as possible. So our kind of performance going into the pandemic was very good locally and nationally in terms of access and waiting times, and we've emerged in a very good position as well. At the end of March, we did have nearly 2,800 people waiting more than a year for their planned treatment. As of the end of May, we've now got that down to 1,140, and we're seeing kind of further inroads being made into kind of access and the minimising of inequalities that might come with that. And just an example in terms of children's services, so our paediatric ENT services over the last year had around 300 children waiting for treatment. We're now down to 25. So, I do want to pay testament to the clinical teams and all the teams across the organisation, because they've rapidly adjusted from the impact of the pandemic and dealing with that into really being focused on restoring services and doing that on behalf of our community.
Thank you very much. I think that's an impressive drop considering some of the national headlines we'd had about waiting times for planned services. Graham, did you want to comment?
Yeah, thanks. Yeah, I mean, absolutely. I think that's really important work, because I think my personal view is we're not out of the woods, and that there's a great deal of uncertainty, I think, fair to say, in terms of where the COVID situation will take us from July 19th onwards. I think there's my personal view, there's some worrying messaging from government that they're going to sort of really pull back in terms of some of the things that are holding, the COVID at bay, particularly like in schools and stuff. Whether that comes to pass or not, I suppose we're just in a lap of uncertainty. So it's, I suppose I'm saying it's really good. I mean, I'm really, I think the long COVID work you've been doing is really impressive. I suppose I was going to ask, but you actually answered it, that you're ready to expand that, particularly around the children, young people. So you're sort of suggesting there's capacity to expand and respond to increased long COVID cases, which is great. So I'm not sure if we're going to come to it later, but I suppose my question was really around that. It's a good situation in terms of the waiting list, and you're on that, but there's also, it connects to things like the cancer treatment targets and stuff like that. It's been a really, really challenging time. And I suppose my question is, how are we set in terms of, getting back in terms of those kind of targets to where we'd like to be? Because obviously cancer treatment is, critical for every individual the times are not being met. And, in general waiting lists, and whether, the challenges facing you, certainly in other parts of the country. And we know that in the Thames Valley, there's a particular issue around staffing pressures and resources. And I don't know if that's something that might impact, or if you've got any action plans to address that over the coming year or so.
Yeah, so I'll try and answer that in two parts. But firstly, in terms of some of the kind of performance standards, which I think, as Councillor Hoskins alludes to, are really, really important measures for us collectively as public sector services for the community, and then maybe something about kind of our staff stability as well. So in cancer performance, we made a really early call through the first wave to maintain as much cancer related activity as we could. So our teams were hugely flexible. They were prepared to move services into other locations like our independent sector kind of partners as well, to be able to maintain kind of cancer services as much as possible. We were then, through the second wave, able to bring many of those services back as we learnt ways of actually dealing with a hot hospital in relation to the COVID activity, and kind of creating kind of COVID cold environments that then protected those non-COVID activities, particularly those time critical services like cancer treatment. So we've actually maintained our cancer services right the way through the pandemic period. Our current position at the end of May in terms of cancer performance, so the 2-week wait standard from GP referral to being seen on a cancer 2-week wait pathway in outpatients, the national standard is 93% of patients should be seen in 2 weeks. We're currently hitting 94% of people, so we're above that standard. For the 31-day cancer standard, which is into treatment, the cancer standard is 96%. We're just under 95% currently. And the 62-day performance standard, which is from the point that your GP refers you on a cancer pathway to receiving definitive treatment for your confirmed cancer, the national standard is 85% of patients should be being treated within that standard, and we were at 84.3%. So we're actually delivering very much either at or above the national cancer standards because we've been able to maintain our cancer activity throughout the period. Equally, diagnostic standards are important as well. So access to CT scanning and MRI scanning and other diagnostic standards. Nationally, endoscopy services have been under significant pressure. Our teams have really recovered our endoscopy kind of performance over the last number of months. And again, as an organisation, the national standard is that a person should receive their definitive diagnostic intervention within 6 weeks. And the standard is 99% of people should be receiving that. We're currently at 96% of people are getting their diagnostic treatment within 6 weeks. And we're working back towards that national standard. So I think that's testament to the fact that, say, we tried not to drop a beat really, even through the second wave, and also the rapid work we've been able to do around service restoration, particularly using the wider capacity that we've got within Reading, particularly within the independent sector. The issue of staff is really, really important. And again, I'd like to say actually thank you to the council for the support that kind of Reading Council and the other two local councils have provided to us right the way through the last kind of year to 15 months. We've been able to actually really invest in significant amount of mental health and wellbeing support and psychological support through our partnership with BHFT. We've received huge support from other kind of anchor institutions within Reading, such as the university, and through public sector organisations like yourselves. So, I think whilst our staff are tired, we actually have got a significant amount of resilience within the staffing team. We've invested in that over the last couple of years in terms of the culture of the organisation and the stability of staff in terms of attraction and retention to work here in Reading. That's paid dividends, but part of that has been through the support that we've had from organisations like yourselves and wider organisations across Berkshire.
So I was curious, particularly on the things that you said about long COVID. What kind of lessons do you think you'll take forward into a hopefully non-COVID or at least better adapted new normal?
Yeah, so I think one of the areas we were already far down the track around was being a highly mature digital organisation. We've invested significantly since 2017 in moving away from paper records, using the digital kind of environment to be able to ensure that our clinical information is much more accessible, developing now more recently the kind of patient portal, so members of the public are much more in control of their own information, and that's been enabled through being much more in a digital environment. We'd also been really looking at how we expand the channels that we're able to offer clinical services through in terms of using virtual channels, whether they are through telemedicine and other kind of digital forms. And really the last 15 months have accelerated or expanded where we've got opportunities to do that. So one of the areas that we were already along the road around that has been further expanded is how we can offer different opportunities for members of the public to engage with us that isn't just about face-to-face. And that has wider benefits. because again, in line with the council, we are really committed to looking at how the sustainability of our environment, low carbon to zero carbon, is part of kind of what we do here within the town, reducing the kind of movement of people and traffic around. And we know that we're a big contributor to that, you know, in terms of where we are here in the town. So actually seeing the opportunity to move more of our services further into the community across Berkshire West, away from the town centre, to use the digital and virtual environment to give opportunities for the public to engage with us in a different way, you know, has wider benefits than just what we're able to offer clinically. So that's for kind of patients and members of the public. For staff, again, it's something we're carefully treading through because there are pros and cons around flexible or hybrid working. And we're really wanting to learn from other public sector organisations around how to get the balance right around that. We're very kind of aware that that works for some individuals, and we want to provide that flexibility. But equally, the kind of value of face-to-face teamwork and that kind of team development that comes from being together is also really important in the sort of line of work that we do. So hybrid working, flexible working is really is going to be a feature of how we operate into the future. But it's an area that we're really cognizant that there's a range of views around, and we need to kind of tread carefully into that space as well.
Brilliant, thank you. And did you want to continue with any other?
Yeah, I'm going to hand over to Eamon for the kind of next question, which was really around the report focusing on the sepsis care pathway as a priority. But I think the committee was also wanting to understand about broader links to prevention and recovery as well, including things like primary care, our links there, lifestyle services, and our work with adult social care. So, Eamon.
Thank you, Councillor. If I could just pick up on the legacy piece as well. Again, I'm new into the trust, but I'm a critical care nurse by background, and colleagues may be aware, but your local hospital, our hospital, at the single largest expansion of intensive care from its funded base than any critical care unit in England. So as somebody new coming in, I was just overwhelmed and enormously impressed at how the staff really went above and beyond to care for local citizens. It was really very, very humbling. And I suppose one of the legacies, which Steve is really driving through, is the fact that the agility of decision making and quality improvement processes that were put in place in wave 1 and wave 2 were tremendous. And how do we capture that, bottle it, and move it forward into a kind of a quality improvement process as we move forward, so people continue to work at the top of their license, that we push decisions down to frontline clinicians to make those decisions and make it as easy for them as possible, and cut out some of the layers of bureaucracy. So that's probably just an observation kind of coming in fresh. You know, your local hospital down the road, we walked here 20 minutes away, has done the most amazing things, and that's certainly with fresh eyes. That's my take on it. Right, back to the script. I suppose the quality account, you'll be aware, is actually a very didactic document. So it's virtually 90% of it is mandated text. We are literally given a template and told to fill in a small number of blanks within a certain time frame. And it's a very rigid process. So we're also told how many quality priorities can go into that quality account and by what time it should be published, etc., etc. So I guess the way we look at it is that the quality account is one vehicle for improvement. If it's not in the quality account, it doesn't mean it's important for us, and it doesn't mean that we're not doing it. So I think that's a really important message. It is one document, one element, but of course, everything that we've spoken about tonight and all the improvements, we are cracking on and doing it with the trust strategy and the vision for the future. So we have referenced sepsis. I'm sorry, I should just go back and say the process of publishing quality accounts, as you know, is heavily disrupted over the past 12 months. So essentially it's stop, start. And then about 8 weeks ago, it was started again, and we were told to publish within about 6 weeks. So what we've done is we've compressed what is a 6-month process into 6 weeks. And what we've chosen to do is roll over the priorities in the previous quality account from the previous year. And one of those was sepsis. And of course, sepsis is really, really important because it is a major killer. It's a major cause of harm. And although it's not directly related to the pandemic, we don't take our eye off other critical medical and quality issues. So that's why we've chosen A, to roll over the priorities, and B, to include sepsis within those. And like everything, we're starting at a good base, but there's always room for improvement. So hence the stretch targets in there about picking up and detecting more sepsis, about being even more robust with our use of antibiotics and reducing antimicrobial resistance. So that's really our kind of journey has been disrupted, and we're back on track now with our priorities.
Thank you. Councillor Robinson. Thank
you, Chair. I'm very pleased to see that sepsis is high on the agenda. And I speak from personal experience, because about 2 or 3 years ago, I woke up one morning with a very strong pain in my stomach, and it just got worse and worse until the point when I asked my wife to call for an ambulance, and I was admitted, and I was given painkillers at that point, and for the rest of the day I was out of it. So in terms of the way that the doctors actually worked with me, in terms of determining what was actually going on, was amazing. At the end of that day, I was fine in terms of, I felt perfectly fine. There was no pain. I really wanted to go home at that stage, except for the fact I was told at the time I had E. coli in my bloodstream, and it had been starting to shut down the organs. So, in terms of diagnosis, it is probably a very difficult condition to diagnose. But thankfully, in my case, it was diagnosed, and I spent, I think, 7 or 8 days having very strong antibiotics pumped into my body. So, personally speaking, I owe RBH a hell of a lot in that respect. But, it's good to see that sepsis is high on the agenda, because I know, a lot of people that I know have had it, and it keeps coming back as well. It's not something that, you have once and then effectively, you're free of it for the rest of your life. In many cases, it is a returning condition. For a lot of friends that I've got that have had the same condition. So thank you for your attentiveness on that particular condition.
Councillor Shikali.
And obviously working with partners across Berkshire. Thank you. But because you're leading so much, and I really think exemplary work in being a thought leader, how are we ensuring right now, when the whole country is facing a challenge, that the lessons you're learning are being shared alongside everyone else, so they can learn from your exemplary work themselves?
Yeah, that's a great question, Councillor. I mean, I think one of the opportunities for us is by being within this HIP2 programme. So the hospital improvement programme is now a group of 40 organisations coordinated by the Department of Health, and we have been actively working with colleagues leading the national programme and offering the opportunity for some of the learning that we've had in a number of areas to be kind of shared. So 2 areas that we're particularly looking to share is around the need to be a highly digital organisation, so as you can really bring the built environment and the digital environment together to best effect, and what conditions you really need to kind of create to be able to do that, being one. The second is that both working with you as a council, but also the strong partnership we've got with the University of Reading and the strength that the University of Reading have in the built environment is something that we're bringing into the organisation with the support of the Vice-Chancellor at the university to effectively see how we can use the hospital as a live laboratory. So how do we kind of use the skills, knowledge and capability of the academics at the university that have got not just national but international kind of experience around this, and how do we actually use that to best effect when we're really thinking about sustainable buildings and a sustainable environment?
Thank you. That was a perfect answer. I was super excited if you couldn't tell. The engineer within me was like built environment, sustainability. We're hitting all my buzzwords. So thank you very much and keep up the fantastic work.
Thank you.
Thank you, Chair.
Thank you. Have life-saving stories and excitement in here tonight. We bring it all for you, Hayes Committee. Thank you. Did you have any final comments?
Well, Chair, I mean, I think the last couple of questions that you asked, we might have touched on a couple of areas. So one was around cancer and A&E services, and I'll maybe very briefly talk about where we are with A&E services. And there was something about impacts on weights for children services, which I might just leave as open if there's any questions on that. But just in terms of time, an area I am concerned about, and I think that there's national concern is around the waiting times in A&E at the moment. It isn't just associated with Reading or Berkshire, it's broadened that across England. We have been seeing normally around a 3% increase in people attending our A&E over the last number of years. But between May 2019 and this May just gone, we've actually seen around a 16% kind of increase, and that's putting quite significant kind of challenges into how we manage the kind of what we call the patient flow through the department. And we're working with the ambulance services, with our colleagues within the community, with our primary care colleagues around how we can actually support the local community around accessing urgent care as opposed to the emergency care, which we within the hospital should be there for. So we've got a fairly steady rate of patients who are admitted to the hospital, but what we've seen is a significant increase in the number of what we call ambulatory patients who are accessing our service for urgent but less time critical conditions. So it is an ongoing area of work that we're doing across the local health and social care system in terms of how we actually make improvements around that. And I'm grateful to Shona and the colleagues within the social care teams around the support that they're giving us on that. One of the positive things for children, given maybe part of the emphasis of this particular committee, is again, we had choices around whether we continued or not. But we felt it was really important that we were able to bring around £4.5 million worth of investment into the hospital here in Reading to improve the facilities within the emergency department. And one of the major improvements that we were able to make through that investment was within our children's emergency department. So we've been able to expand that significantly, create both a larger but much more appropriate kind of environment for children, and particularly an environment for our sickest children who are coming through the emergency department to be treated really effectively. I have to say it was one of the areas that if you'd asked me, what often would keep me awake at night, certainly kind of some of those facilities within our emergency department for the volume of children that were coming through. So the fact that we've now got expanded and better facilities is a real improvement for the children within our community who do need to access our service. But certainly A&E services are under pressure, but it's something that is a national phenomenon at the moment, and we have got really great support from yourselves within the council, but also other providers across Berkshire to try and resolve.
Excellent. Thank you very much. Councillor Hoskin.
Yeah, thank you, Chair. And actually, I was going to ask about A&E, and I think you've pretty much covered it. Other than I was just really interested in your view, actually, around why. I've got some personal views, but why, in terms of you think you're seeing this increase in A&E attendance, but and it seems to be closely connected to or rather the same forces may well be impacting on the ambulance service, which is under particular strains in a lot of 999 calls. So that was just your interest in your view on that. One of the other items that we did include, it was included in Councillor James's letter to you, and we're taking this opportunity to want to raise with you. We do want to raise with you ask questions around the closure of the hydrotherapy pool, which is obviously you're going through an engagement process, and you'll be aware that this council has unanimously, at a meeting just a few weeks ago, unanimously opposing the decision to permanently close the pool. And it's one of the difficult situations for this is that this process of looking to close the hydrotherapy pool is happening during this time of a pandemic, that a lot of the interested groups have felt they've not really been able to, be involved. It's also the case that there was a consultation by the NHS commissioners, the CCG, around the commission and NHS hydrotherapy services, which also this council unanimously disagreed and said to the CCG we didn't agree with the change to the sort of clinical referral process, opposed to the block funding, and in fact, one of the reasons why we were concerned and opposed that was because we felt that we put the hydrotherapy pool in the RBH on an unsustainable, footing. Although we were told at the time, and the public consultation was very clear, that it wasn't about the physical pool; it was about the commissioning. And now we have a process that yourselves are coming through, and I understand the situation that you're in terms of limited finances and the commissioning decision. We're now in a situation where the hydrotherapy pool is going to be permanently closed, but there's been no actual sort of formal public consultation around that, and the previous commissioning wasn't, the CCG consultation wasn't about the pool. So you can sort of see the issue around that. So I'm interested in your experience of the engagement process. I would also like to take this opportunity to make the case again that we're really concerned. This was something which reflected across the political parties, the discussion we had, that that the NHS as a whole, this is yourselves and the commissioners, are not looking enough at the wider impacts and the preventative nature and the more holistic impacts of hydrotherapy, and also the growing, we talked about the need for around rehabilitation, long COVID, that actually there may well be, increased demand for the kind of rehabilitative services and physiotherapies that are particularly well suited to hydrotherapy. And I haven't got it here. I know there's within NHS England, they're looking at some of the evidence around the greater persistence of people using hydrotherapy as opposed to, I don't know, call it land-based or non-water-based physiotherapy, that people, because they just enjoy it more, they're more likely to come back and see through the course. So, look, I realise that you've got, really difficult funding situations. I wonder if you can shed any light. This is not your bag, because it's actually the CCG. We're in a situation where you're permanently closing the pool, and there's no obvious alternative provision that exists for the people of Reading and Berkshire West, and also in terms of your response to the engagement process as well. So yeah, those are my questions. Obviously, our position on the matter, and obviously I'd love it you turn around and say actually you've changed your mind. But if there is a glimpse of hope around any kind of future provision for the people of Reading, and also hope around how that provision can be not severely restricted through the the referral process that's been put in place. So sorry, it's quite.
No, Councillor. Look, I take this matter really seriously, and I'm really grateful for both the kind of the question and the challenge, and the opportunity to have a conversation about it. It's a really difficult decision to make, and one that I definitely have not taken lightly. A little bit of quick kind of history. So certainly when I first arrived in Royal Berks as the chief exec in early 2017, there were moves to close the hydrotherapy pool at that time. I think that felt very uncomfortable because of the level of kind of consultation and engagement that we'd had at that point. And I, with the support of Alok Sharma, involvement of Martin Salter, and with a range of stakeholders, we kind of met together for around a year really to try and look at what options there were. And in early 2017, I reversed the decision about making a closure at that point. The three things that we drew from that time working with the stakeholder group were this, that the CCGs needed to make a commissioning decision about the long-term viability and future of water-based therapy treatments like hydrotherapy for the residents of Berkshire West. my commitment was that in the context of that decision, we would not close the pool until there was alternative provision available if a form of service was still to be commissioned. And then thirdly, the stakeholder group recognised the fact that any form of hydrotherapy provision didn't need to be on an acute hospital site. So those were the kind of three key things. The commissioners did undertake a review of the commissioning arrangements for hydrotherapy, and their decision was to move to the individual funding request approach, which we know will will reduce the number of people accessing hydrotherapy services, both adults and children. In the last full year of when we were able to provide hydrotherapy services, the pool has been closed for certainly the best part of 15 months or more now, because of some of the infection control issues that are very real during this kind of COVID pandemic period. So we had around 270 patients referred via NHS routes using the hydrotherapy service. I'm not going to make any comment, Councillor, around the kind of the comparison between land-based or water-based services. That's not for me to do, and I fully recognise that actually for patients and some users that do use hydrotherapy, the benefit they personally get, is material to them. So it's not for me to make any kind of comparison between land-based and water-based, because it is clearly important to people. We with the further likely reduction through the IFR process of referrals into hydrotherapy, and a commitment from the commissioners to source an alternative for both adults and children. And I know that they are in some of the final throes around that for adult services, and our clinicians are involved in supporting the CCG in looking at alternative provision for children as well. And my understanding is that they are really at a point of identifying what that might be. I'm genuinely not in a position to say what that is, because I'm not actually privy to where they've got to in terms of some of the final decisions, but they have made a commitment to find alternative provision for both adults and children for NHS referred patients through the IFR process. So with that in mind, and given the fact that we do have to make some difficult decisions about the economics around this, to bring the hydrotherapy pool at the Royal Berks back into play will cost us £1 million straight off the bat. 750,000 just to do the infrastructure works in terms of kind of heating, water temperature, the physical environment, and then an ongoing cost outside of direct staff costs of £250,000 a year to maintain the pool. That would be in the face of decreasing NHS numbers, and whilst I really understand the challenge it also might provide for those non-NHS user groups, which again I know they gain value from it, but if I'm just being blunt, the revenue that we are able to gain from non-NHS users is around, at the best year was £20,000 that we were able to gain through that. So we have to make some choices about where would we put £1 million at the moment in terms of the population of Berkshire West and some of the recovery and restoration of services. And so it is a really difficult choice. It's not one I take lightly to close the pool, but I do feel confident I've maintained my commitment about working with the CCGs around their decision on the ongoing commissioning arrangements for NHS patients receiving hydrotherapy, and B, that we've been able to support and influence their decision about actually securing alternative provision for both adults and children.
I'd just like to thank you for that response. I mean, it's difficult for us as councillors to hear that, it's probably all okay, there will be some alternative provision. But I would like to appreciate what I'm hearing is the work your trust is doing to work with the commissioners to work through that provision. I mean, I guess I think I'd this is kind of to fellow councillors, I think, I certainly feel quite strongly, and this isn't necessarily to you, is that there is going to be a piece of work which is about the adequate provision of NHS hydrotherapy. If there is alternative provision, I don't think it will be at the level that will necessarily meet the demands and the requirements for the people of Reading and the wider area. And I think that'll be something that we'll need to pursue with the commissioners. I think the individual funding request process, I don't think is the right approach personally. I think that will also lead to a greater inequality of access, and besides, I think actually there's probably going to be real need and an increasing need for it in the town. But I mean, in terms of yourselves and what you said, I think that one of the things we can ask from you, is obviously not changing the decision, is that we get that alternative provision, that you're working with the commissioners to see that. Obviously we would have liked to have seen that before you close the pool or make the decision, but obviously that's not the situation that we're in at the moment.
And Councillor Oscars, I don't want to duck also the engagement piece. So I think again we've tried to be very transparent. I've met personally with some of the non-NHS user groups. I've got a session tomorrow with around 6 to 8 of the representatives from various user groups. Alok Sharma is coordinating that meeting. Martin Salter is attending that as well, given the consistency of his input kind of previously back in 2017-18, and we've extended some of the kind of engagement kind of opportunity into July. So genuinely, where there are forums or groups or individuals who want to have a further conversation around the current decision and the future arrangements, we're being very open to be able to have those conversations and not close that engagement down.
Thank you very much. Thank you to Steve McManus and Eamon Sullivan for your time this evening. It's been really helpful for us to understand and discuss the accounts with you. So thanks for your time.
Thank you, Chair. Really grateful for the time.
Brilliant. Okay, moving on to item 7. That's the Berkshire Community Equipment Service.
Okay, hopefully you can hear me through the microphone. So this report is about the Berkshire Community Equipment Service. It supports residents at home with sort of items of equipment such as rails, sensory alarms, hoists. So it's a key equipment to keep people at home, and it's provided to us by NRS Healthcare. The contract is managed by West Berkshire Council on behalf of 6 of the unitaries across the Berkshire and the 2 clinical commissioning groups, and the value, as you'll see from the report, is 1.4 million. This contract is due to expire on the 1st of April 2022. We're in a 5-year contract with a provision to extend for 2 years. The additional part, which is Reading only, is that we developed an enhanced technological enabled care, which we commonly call TEC, which is provided by Turnkey. It's a pilot system we started in November, and it provides more sophisticated items of equipment and sensors and those sorts of things to keep people at home. We that value of that aspect of the contract for Reading only is 384, and it is provided for within the current framework that we already have in place. So from the as you'll see from the report, demand is increasing, and it's a contract we would wish to continue at the current time, not least that we're in a consortium arrangement, and secondly that with the advent of COVID and the need for some stability in regards to providing equipment, it would perhaps be ill-advised to start reprocuring and potentially absorbing a lot of time in that, and it seemed a sensible approach for us to come to committee to ask for the extension. We have been issued notice because obviously this is an opportunity for any of the partners to terminate the contract, but what I am bringing to you tonight is a recommendation that we extend the contract as part of the agreement for the extra 2 years, so from the 1st of April 2022 to the 31st of March 24. and that we also seek agreement to extend the turnkey arrangement for tech, because that's an increasing area of use, and you'll see the data that obviously equipment is key, and what we've just heard from our health partners is going to be key going forward. So we're asking for agreement to extend, and we're also asking for agreement for the turnkey to extended. I'm happy to take any questions, Chair.
Thank you very much. Councillor Hoskin.
Yeah, thank you. So, do we announce? Unfortunately, Councillor Ennis is not able to be with us today. He's fine, but I think he's isolating at home. So, I'd just like to welcome the report. I think this is the pragmatic and sensible decision. I think, in particular, there are the development of joint commissioning across the piece for areas like this where it makes real sense. For better services. I think it's important to maintain that, and also it's exciting in terms of the tech pilot. I think that's stuff that we'll see more coming back from in terms of outputs, and certainly support the continuation of that as well. Thanks.
Excellent, thank you. There's no further questions, so I think this sounds sensible. Are we happy to accept the recommended actions? All agreed? Wonderful, thank you very much. Thank you, Karen. All right, moving on to item 8, which is the accessibility strategy. I think we're going to be joined by Deborah Glassbrook on Teams. We can't hear you, Deborah. You're muted. Someone had to do it.
Good evening. Somebody had to do it. I'm sorry, I'm the first this evening. So good evening, everybody. For those of you who don't know, I'm Deborah Glassbrook. I'm the Executive Director of Children's Services in Reading Borough Council and Brighter Futures for Children. Thank you for the opportunity to present to you this evening the Reading, our accessibility strategy, alongside the school's adaptations framework, which you have hopefully in your paperwork. The school adaptation framework is also known as the school access framework, which you have as an appendix. The accessibility strategy has been jointly written by colleagues in the council and Brighter Futures for Children, as we have a sort of joint responsibility, a number of the actions and elements that you'll see included in the policy. We're bringing this policy or this strategy to ACE this evening for sign off, please. So just thinking about what the policy and the strategy outlines, there is a requirement to write the accessibility strategy set out in Schedule 10 of the Equality Act of 2010, and this specifically relates to pupils with a disability. The NEA accessibility strategy doesn't apply to academies or free schools. However, all schools, including academies and free schools, must have an accessibility plan, which is based on the same principles as any accessibility strategy. So just to be clear in terms of which disabilities are included, it refers to any situation where a child may have physical impairments, learning difficulties, any sensory impairments, or mental impairments. And in order to make any adjustments to enable those children to access all that they need, there's a requirement to take reasonable steps to avoid any substantial disadvantage to those children, which is referred to as a reasonable adjustment. And again, both local authorities and schools must adhere to that reasonable adjustment duty. So what the strategy does is it sets out the steps that need to be taken to ensure that any child with a disability can fully participate in the education provided by the school, and that they can enjoy the other benefits, the facilities and services that the school provides for its pupil. So this purpose of the strategy relates to 3 main elements, as you will have seen in there. Increasing the extent to which disabled pupils can participate in the school's and early years curriculum, improving the physical environment of the schools for the purpose of increasing the extent to which disabled pupils are able to take advantage of education and benefits, and improving the delivery to disabled pupils of information, which is readily available to pupils who are not disabled. The 2014 Children and Families Act required all local authorities to have what's referred to as the local offer, which is where a lot of the information that's provides information about all of the services that should be available on a local basis. And our local offer here in Reading has been very well regarded and has recently been put forward for an award. What you'll see also in this strategy is how we're going to implement the accessibility strategy, and you'll see there's detailed expectations of how the council and Brighter Futures for Children work in partnership with all the stakeholders. What's also included is details of the funding, and it shows that there's 3 different elements of funding for schools. One is where there's an expectation that schools use their own budgets to make the reasonable adjustments. There's a £6,000 per pupil amount available with some additional monies depending on the particular circumstances, and there's also top-up funding. And in most cases, schools are receiving this funding through the SEND service for pupils with education, health and care plans, although there are exceptional circumstances when schools may be able to access money for children who don't have such plans. You'll also see in the strategy examples of work and improvements that have been already undertaken under each of those 3 elements I've just highlighted. We are committed to keeping the policy under review, hence bringing it to you again this evening, and we make sure that the strategy is well informed by feedback from parents, carers, children and young people, voluntary organisations and all professionals supporting the SEND strategy. So in terms of delivering on the SEND strategy, which is part of the accessibility strategy, the vision is to safeguard and protect those that are most vulnerable, providing the very best life through education, early help and healthy living. So our accessibility strategy demonstrates our continued commitment to provide the best education possible to all young people with special education needs and disabilities in Reading, to enhance their life chances, prepare them for adulthood and enable them to contribute to their community. Thank you.
Thank you very much. Councillor Pearce.
Thank you, Chair. Yeah, I'd like to welcome the report and thanks to Deborah for the introduction, very detailed introduction. I just wanted to focus on 3 points of it, that this is an accessibility strategy for both the physical environment and curriculum access. So I think when people read accessibility, they think of getting into a building, but it's not just that, it's the accessibility for pupils to be able to access all areas of the curriculum. As Deborah stated at the start, this is a strategy for our maintained schools only. So this is the accessibility strategy for RBC maintained schools, although other schools obviously will have their own ones that will still follow very similar guidance, and that it's constantly under review, and this will form part of the piece of our SEND strategy review, which we'll do more work on later in the year. So welcome and thanks for the report.
Councillor Shikali.
Thank you, Deborah, for the update. It was really good. So you explained that all schools have to have a plan for accessibility, and the strategy, like Councillor Pearce just said, is for maintained schools. But what happens in the case of free schools and academies, specifically if residents are unhappy with the level of accessibility or reasonable adjustment that's being made for their children or young person in regards to any disability, whether it's physical, learning difficulty, sensory or mental?
Yes, thank you very much for that question. So in relation to all of our schools, as I just mentioned, the academies and the free schools, they are required to put their accessibility plan on their website. It's also on our local offer. So all parents and children, young people ought to be able to have a clear understanding of what's expected and what is on offer. If there are any issues, then it will be a question of them taking those up with the individual academies and the free schools and raising a complaint with those particular educational providers.
Thank you. Thank you, Chair.
Thank you very much. I think that's all for questions. So committee, are we happy to accept that? Excellent, all agreed. Okay, moving on to item 9, which is the annual engagement meeting.
Yes, and thank you very much. This is my item again. Thank you. So we wanted to present to committee the report in relation to the annual engagement meeting, which took place with colleagues from Ofsted in March 2021. So what happens at an annual engagement meeting is that it's an annual meeting, hence it's been called an annual engagement meeting. And what happens is that each year I meet alongside the 3 directors that I have working with me, the Director for Children's Social Care, Director of Early Help and Prevention, and the Director of Education. And we meet with both social care and education Ofsted inspectors to really identify what's working well, but also what needs further work and development. And what's really interesting about these meetings is that they were put in for local authorities to have these really open and transparent conversations so that Ofsted and sometimes CQC inspectors can identify where there are problems, with the concept of trying to catch local authorities before they fall. And this came on the back of the fact that there had been a significant increase in local authorities being judged inadequate in the past. And that was primarily because local authorities were only inspected on a 3-year basis, and the idea being that lots can happen a 3-year basis, and so these annual meetings were put into place. And you'll see that what we've sent to you is the letter and the 2 self-evaluations that were used to form the evidence for the meeting. And those are really helpful opportunities for all of us in the organisation to reflect and pull together the evidence, as I say, of what was working really well. And those areas we know we've got further work to do. The annual engagement meetings don't result in any gradings. It's not an inspection as such, but it's really an opportunity to identify any significant concerns. And if there are any significant concerns, then there can be a full inspection triggered by the inspectors who have been part of that conversation. I hope you'll be pleased to know that there was no such triggering of any inspection as a result of the conversation that we had in March of this year. So this was the second meeting that we'd had. We had our first meeting in March 2020, following our ILACs, that's our the inspection of the local authorities, which we had in September and October of 2019. 6 months later, we had our first annual engagement meeting. And what you'll see from the letter is that the inspectors identified a number of things that we discussed with them, including the fact that our government in direction had lifted, which was a reflection of Brighter Futures for Children's Progress. That happened in February of this year. They were able to identify the ambition that we have for our children. They noted that the new chair of the Brighter Futures for Children board was in place, and that person, Di Smith, was the previous chair of the Children's Service Improvement Board, and that they were able to see that there was tighter governance arrangements that we discussed with them as part of that. We were already very pleased to be able to report that we had stable and permanent staff and senior and middle management, and that was a real difference that we were able to report, and we're very pleased to be able to do so. We talked about the strong partnerships that we have, both within the council, but within the broader partnership and the system that we have here in Reading. And we also talked very much about our developing practice approach, which is being about trauma-informed and restorative approach. We talked about the turnover of staff and the higher caseloads in some teams, and the impact that COVID had on some of that work, and the complexities of the referrals that we were receiving as a result of children and families living in lockdown. We talked about the very exciting opportunities we have developed for a range of different staff becoming social workers, and we talked about, as I say, the recruitment and retention priorities that we have to increase the number of permanent staff. We also reflected on the increase in serious violence that we'd seen across Reading in the previous 12 months, and the very sad recent death of 2 young people, one who was a child in January, and another young person young adult in February. And we also talked to them very much about the focus we have on quality assurance, taking the lessons learned from those sorts of incidents and from the audit work that we're doing to improve further the quality of the service that we're providing to children and families in Reading. In relation to education, we talked a lot about how we are embedding the school improvement model and are really pleased to be able to announce the significant number of our schools that are good and outstanding here in Reading. We talked about the impact of COVID-19 on school performance data and the fact that, of course, exams stopped, and so we didn't have this sort of attainment data that we've used before, and we're thinking about how we are going to assess and support schools to continue to provide the very best support and education opportunities for our children. We talked about Reading having above average attainment 8 scoring in 2020 and hoping that that will continue in the future once we get back to having attainment data. We talked again very much about the high ambitions we have for children with SEND, and you'll know, most of you I think, and if you don't know, that we had our SEND local area inspection over the last 2 weeks, and we'll be able to look forward to sharing the outcomes of that with you over the next few weeks. In education, we're very keen to work on co-production, and that's something that was particularly important for us and when we're looking at working with children and families who have got SEND, and we have a huge commitment to inclusion, and that's very much demonstrated through how we're working in education, and again relates back to what we were just saying about our accessibility strategy. They were interested in talking to us about the increased numbers of families choosing elective home education, and we did see a significant rise in the 12 months prior to their previous visit, and that was very much affected by COVID-19 and the lockdown that families were experiencing. And we also talked about the improved performance in relation to our young people who are not in education, employment and training. And, you know, it is a key area for all of us to take responsibility for in thinking about those more vulnerable young people and our children and young people who are in care who have not yet managed to stay in education or get employment or training. And that is a key focus for our ongoing work. So in response to all of those discussions, we got the letter that you'll see attached to the documentation this evening. And again, what we were able to reassure the inspectors about is that we've got continuous improvement plans and service plans that capture all the actions that we've needed to do to address the ongoing development improvement, both from the inspection from 2019 and all of the work and quality assurance work that we're doing on an ongoing basis. So I'd just like to finish by saying that we continue to be incredibly ambitious for the children and families of Reading, and we're committed to achieving the very best in partnership with them. Thank you very much.
Thank you for that comprehensive report. Councillor Terry.
Yeah, thank you, Chair. I'd like to thank Deborah Glassbrook and her team, and certainly for that very comprehensive introduction to the report. There's an awful lot of information in here, which is why we thought it was really helpful to bring it to the committee so that you can see kind of a wide range of information that shows you what's going on in a wide range of the services. Councillor Pearce will talk about education, but clearly you can see the journey that we've been on. You know, it requires improvement to be good, and we're clearly heading in the good direction. We've come out of intervention in children's social care. I didn't answer the question Councillor White asked earlier, but if you've had time to read it, you'll see that, you know, we still have too many children in care. That's true. But what we can see is that we're moving towards more than the national average, and the numbers are going down, and there are sometimes specific reasons why they go up. But our intention is to move to a situation where we're absolutely sure that we take children into care when we need to, but that we look to take them out of care quickly as well. And you'll see services like the reunification team work, which is getting embedded into practice, actually looks very carefully at those things to see if we can then stop that intervention and enable children to return to their families or other carers who are more appropriate for them. Obviously, as the council, I mean, there's such a lot that's been said here, it's contained in here. I'm not going to go over it. Things that I worry about, you know, I have to have conversations with Ms. Glassbrook from time to time to say, you know, how are we do I need to worry about anything? What about safeguarding? You'll see in here that we work closely in Berkshire West across the other two authorities, and that there's been praise for the safeguarding. I think you just need to also note that particularly this progress in the last year has been made during a pandemic. And I think it's quite testament to the whole team of people and all of the staff across the service. But, you know, we hear a lot about schools because they're in the press all the time, quite rightly, concerns about the way in which we can ensure that our children have the education that they deserve and they need. But in the background, you know, we were doing virtual work, we were doing the visits, we were making sure that children are still safe. And in early years, actually, early identification of the needs of children. We know that's something we need to do a bit more with our partners, but we've, you know, got a really robust One Reading Children and Young People partnership. I didn't get into the discussion with the Royal Berks tonight because the questions had been sent before. But, you know, the participation of the Royal Berks in our partnership is really, really good. And we know that they are really listening to the needs, the complex cases that turn up at the hospital and the way that we all work together to tackle those. So there's a huge amount of work going on. Undoubtedly, there's a long way to go. And undoubtedly, there will be times when things don't go the way that we want them to. But I think we can see really strong progress being made in the right direction. And as I was going to say earlier, but I'll say it now, for the council, that also is about funding and money. Councillor White's question that we didn't get to kind of to indicate that, you know, surely then there's not enough money to go around and we're not meeting all those needs. I mean, that's a completely different question really about the way in which we're funded. But I would like to assure the committee and members here today that, you know, Brighter Futures and Reading Borough Council are now working really well together. And last year, the budget outturn figures aren't all announced, and I'll have to hold my breath a bit on the final figures. But I think we come in on budget for the first time in a really long time. They had a budget, they used the budget the best way they could use that budget. They had to find savings because we just don't have enough money to go around, and they did that. And this is in the context of, you know, the government now commissioning work on concern about the fact that the cost of looking after children is huge. You know, some of the placements that we have to make, thousands of pounds a week for children in care. And I know Councillor Robertson, we talked about this before, and you very gracefully said about the fact that we need to encourage more foster carers, but sometimes we do need that specialist care. And there is a sense across the country, and the government's listened to that, that maybe those providers are really taking more money than they should from the public purse for doing something really important about looking after children and making it really difficult for all of us to do our job. So we look forward to seeing the outcome of that. I also am looking forward to the outcome of the review of children's care anyway. Some questions have been out there for a while now about how quickly and easily sometimes children are taken into care, and could there be a different way? And what they're talking about is the things that we've been doing here, the therapeutic work that goes on in schools that's led to also the trauma-informed practice that we now have, not just in Brighter Futures for Children, but across schools and across our health partners, all looking at a different way of thinking about, you know, how do we best, you know, keep children and young people safe, but actually also ensure that they can develop well and fulfill their potential in the future. So I think there's some exciting things to come, and it's really great progress. And once again, Deborah, please take certainly my congratulations back to the team. Thank you, Chair.
Thank you, Councillor Terry. Councillor Pearce.
Thank you, Chair. Thanks, Deborah, again as well. I won't focus on everything that we've covered. There's a huge amount that Deborah covered in the report, but I wanted to go into which links into maybe the previous report of the SEND capacity work that's going on, and just to shine a light on what's going on there. So we've got the Hamilton School for our SEMH students is currently in progress of being updated. The building is on site there and progressing well. Identifying 2 new ASC units for our primary schools. That work there is ongoing, and we're hopeful for those to be up and running in the next year. The expansion of a class of the Avenue School again is on track and hopefully to be approved soon. And it was the first of 2. I'm going to the one in 2 weeks' time of the Oaktree Schools consultations today. and the Oaktree School, remember, is our new school for our young people with ASC, share between us and Wokingham. That will be 75 pupils each. So there's a huge amount of work going on to increase our capacity in schools. And then linked within that, as we've mentioned, the therapeutic approach in our current schools has helped us lower our exclusions. We've been very proud of the EHCP processing that we've done recently, where we are in the timeframes, and the quality of those plans are still very good. And the last thing I just wanted to, which Deborah did touch on, is this has only been possible because of the trust and relationship with all of the partners that have been involved. So obviously that includes us and RBC and Brighter Futures, but actually it's everyone else involved, and that trust and sort of the quality that people now think and believe is there has been built up over the last few years, and we hope that will continue with good work into the future.
Thank you, Councillor Robinson.
Thank you, Chair. And I echo Councillor Terry's words in terms of congratulations for you, Deborah, and the team. A great report, and thank you for bringing it to Council this evening. Certainly a lot of hard work and effort went in terms of explaining for Ofsted exactly where we are in the process and the ambitions moving forward. What I was disappointed, though, was the actual letter from Ofsted. You know, it just seemed when I was reading it that they were reiterating everything that was written in the report and what was actually presented to them. There was no, you know, real guidance, no recommendations, no validation in terms of, you know, the way that that we're operating. So I heard that. But yeah, it's disappointing for me to read through that letter and not actually get anything from it. You know, given all the hard work and effort that obviously, you know, writing the reports out has been. So, you know, the only critique I have really is about Ofsted's response. There should be something more in there that can be used for the benefit of Brighter Futures in terms of, you know, giving validation to what we're doing. So that's all I have to say. All right.
Thank you very much. Are there any? Oh, Councillor MP Coles.
Thank you. Thank you, Chair. Thank you, Deborah. Thank you, Councillor Terry and Councillor Pierce. I think this question is directed mainly to Councillor Pierce. It's about the Avenue School, an incredible special needs school that we have in Reading. But it is also looking at how are you managing, because there's on the report, there's something about the school intake is from September. So just finding out how are you managing? Is there a waiting list for special needs school and those with extreme autism?
Thank you. And I know we've got a governor sitting across at the Avenue. So I said the capacity of the Avenue has been increased this year. They're going to have an additional class. And you're saying about the AS is quite right. And it's not just going to be at the Avenue. We're going to have a whole new school in Winnersh, where 75 of our pupils from Reading and 75 from Wokingham will go. And it will depend on the need, because actually lots of the things I mentioned, we will also have units in 2 different schools for primary school. We're also looking at 2 to be set up in early years schools. So what happens in, there's not really a waiting list, doesn't really work like that. It's more that you get your EHC plan, the young person, and the right provision will be found. So it's not akin to there's, you know, people waiting to go into a list. They'll have the plan in place, and then the right provision will be found for them.
Thank you very much. I think we're pretty much all in agreement, so are we happy, committee, to note? Thank you very much. Okay, and the next item is the revised admissions policy at Holybrook School. I've missed one. School admission amended arrangements. Apologies.
Hi, good evening. I'm Victoria Hannington. I'm the school admissions manager, and I'm here presenting on Kate's behalf, but it's my paper. So we normally ask the ACE committee to determine the school admissions policies each year. Last year, the government consulted on changes to the school admissions code, which I believe the regulations have been laid out in Parliament, and we're just waiting for it to be agreed. It may have been agreed today. I don't know. I haven't heard the news yet. So point 1.7 of the new code requires children who appear to have been in care outside of England to be given the same priority in the oversubscription criteria as children who are in care or previously in care in the UK. So we have amended the community school policies for 21, 22 and 22 and 23, and we're asking the committee to redetermine these policies for us.
Thank you very much. Councillor Pearce.
Not much, nothing to add really. It's just a process report, as Victoria said.
Wonderful. Okay, no further comments. Are we happy to agree, this committee? Lovely. Okay, now we're on to the revised admissions policy of Holybrook School. I think I've got Deborah back and Jill Dunlop.
Thank you, Chair. Jill, are you there? Or Victoria?
Hello. Yes, sorry, I wasn't aware that I was presenting this tonight, but I do know about the Holybrook policy. This policy has been renegotiated and updated by Nikki Stevens, who's our SEND team manager, and it was updated in collaboration with the head teacher of the Holybrook School and the governing body, and the purpose of updating with the policy is to ensure that the SEND team have an input into the children that are actually being referred to and accepted in the school, because I think over the years that there'd been some drift in that, but this is to ensure that the SEND team on behalf of Reading Brighter Futures for Children are clearly involved in the whole admission process. So it is an update to the policy. It has been agreed and ratified by the governing body at Holybrook, and we in Brighter Futures are very pleased with the update. So we're just asking for it to be noted.
Thank you, Jill. Councillor Pearce.
Thank you, Chair. Yes, Jill said this will help the collaboration between Holybrook and Brighter Futures for Children to get working close together to get the provision right. And what I visited Holybrook last week. I hadn't been to a red list country, so it was okay. And the head there, Lee, is looking for governors. So if anyone wants to be a governor, which obviously part of this process is a plea for governors. If you'd like to be a governor, then please get in contact at the Holybrook.
It's certainly being a governor is a good way to pay back to your local schools. Okay, I think we're all happy with this. All agreed? Lovely. Flying through it. Thank you. Supporting children with medical needs policy.
Yeah, that's me. Thank you, and good evening to everyone. As you'll see from the cover report, the Supporting Children with Needs policy sets out how Brighter Futures for Children on behalf of Reading Borough Council will comply with statutory guidance to support children who cannot attend school due to medical needs. The overriding aim is that children continue to have a good education and make good progress, and that they return to school as soon as possible, because our overriding tenet is that children learn best when they're in school. Obviously, we have home educated children, but children who should be in school and are registered in school, we believe should be back in school as soon as possible. In terms of legislation, the policy sets out the legal context in which the policy is written and the statutory guidance that we have to comply with. It also sets out the roles of Brighter Futures for Children and the schools. And as you will see, the school's role is firmly set. The policy firmly sets the school's role out in terms of the responsibility of schools in making reasonable adjustments for children who still could attend school, and that's set out in another document called Supporting Children in School with Medical Needs. So there are two policies, there are two DfE sets of guidance that sit along each other. So we were very keen to make sure that this policy sits alongside the school's responsibilities to ensure that children still can attend school where they're able with adjustments, even that if that means attending part-time, it means that they can keep in touch with their peers, which is what we would all want, and keep in touch with their teachers. So obviously the better stance for us is that children do remain in schools. This policy, however, sets out what will happen and what the responsibilities are where children can't continue to attend school. It sets out the expectation of partnership working for all stakeholders, and that includes putting children and families at the very heart of it as well, so that everything is set around what a child can manage in school and how the parents can support that and how the schools and health services can support it as well. As you can see from section 12, this policy has been co-produced and consulted upon via the SEND2 strategy working group. This SEND2 group is co-chaired by Ramona Bridgman, who is the Reading Families Forum chair. So the Families Forum were involved and consulted on that, and you can see the list of stakeholders that were also contributed to it and were consulted on it. So it's an extensive list of people that have representation in that Strand 2 group. Including Berkshire NHS, which is a vital partner in this. I am in the process of writing a set of procedures to back up this policy, so that clearly sets out further expectations and responsibilities and how the policy will be implemented. So I'm asking that the policy is ratified, and happy to ask any questions.
Are you, Councillor Terry?
No, I've got nothing to add to it. I don't know if Councillor Pearce does. No.
Okay, no indications. So everyone happy to agree and ratify? Excellent. And we move on to the final item, which is safeguarding audits. Thank you very much, Jill. Safeguarding audits.
Yes, hello, it's back to me, and a thank you to Jill for doing a quick recovery on the covering the Holybrook piece, so thank you very much for that. So we wanted to present to you this summary report in relation to 3 safeguarding audit pieces of work that we've done to provide the assurances around the fact that the company and our partners are providing and meeting safeguarding and the wellbeing requirements across the service areas. So these 3 audits capture the safeguarding measures that we use in the company across the local area schools, including nursery schools, and the local area early years settings. The first two audits are statutory requirements, but the third one we do for our early years is just best practice. And we want to make sure that wherever we have got an opportunity to use our best practice opportunities, that we are doing so. So what you'll see is that there are 3 audits, as I've just mentioned. There's a Section 11 audit, and there's a Section 175 audit, and then the early years one, which is a very similar to the 175 audit. And what happens is that the Section 11 refers to the Children Act of 2004, which actually places duties on a range of organisations and individuals to ensure that our functions and services that we contract out are discharged and meet the requirements to safeguard and promote the welfare of children. So locally here in Reading, we submit a Section 11 audit report to what's called the Section 11 panel when requested, and that's usually about every 3 years now. And the panel is a Berkshire-wide subgroup of the Berkshire West Safeguarding Children Partnership. So we presented this Section 11 audit in December 2020. I apologise that it says 2021 in the report. We're obviously ahead of ourselves, thinking that we're going to do another one this year. So this was the first report that we had submitted as Brighter Futures for Children, and what you can see here is a summary of the Section 11 returns, which of the all of the measures we were able to demonstrate that 31 of the measures were met, 2 partially met, and none that were not met at all. And what was particularly good was that we showed it was a good understanding and ownership of our responsibilities, and there were good contributions to the audit, that we've got strong governance arrangements with strong board engagement, and that's the Brighter Futures for Children board engagement, and that we're able to give good challenge on key elements. There was an improving picture for the company of Brighter Futures for Children in terms of strategic direction, looking at the improvement plans and our business plan, and strong proactive and reactive processes in relation to recruitment and allegation management. We were pleased to note in the follow-up letter that we all received following a submission to the panel, that the panel was in agreement with the information that we provided, saying that it was clear, reflective, and demonstrated as our organisation understands and complies with the wider Section 11 duties placed upon us. So that was, very positive assurance that we took from that and wanted to share with you this evening. There were 2 further reports, the Section 175 report, as just mentioned, which was completed in May of this year, and that's done and considers how schools in the local area are managing their statutory responsibilities in relation to safeguarding. Very pleased to report that the key findings of this report in relation to schools shows that the high majority of all the settings met all of the requirements, with 100% of settings meeting the requirements for leadership and management of safeguarding, managing allegations, reporting concerns and record keeping, and pastoral care, local procedures, early help, parental responsibility, and children missing education. There has been a significant reduction this time in the unmet elements relating to the relevant safeguarding standards, with a total difference of 44% reduction in unmet needs. So again, congratulations to all of the schools who were able to really focus and bring about those changes. In terms of the early years safeguarding audit, as I've mentioned, it's the best practice audit that we've undertaken. We undertook this with all of the settings that were available at the time. It was 64% of childminders and 98% of other providers returned the safeguarding audit, and we were very much aware that some of the childminders were not involved this time due to the impact of COVID and the fact that they weren't available or providing childminding services just at this time. So what we found this time is that most providers who returned an audit identified at least one action that they wanted to undertake to enhance the provisions around safeguarding practice, and that really gave us some real confidence about people's ability to reflect and know themselves. And we're really pleased that the early years providers in Reading have given us the confidence that they've met the safeguarding criteria at a high level. So what has come out of all three of those audits are action plans that are being implemented and monitored to make sure that when we undertake those audits again, there will be either consistent or indeed improved outcomes. But I hope what the committee will see from this report is some strong reassurance that we are quality monitoring, safeguarding across all of the settings I've just talked about. Thank you very much.
Thank you very much, Deborah. Councillor Terry?
No, I've got nothing to add to the report. I can see, you can see for yourself the work that's been done. I mean, I think it's important for committee to see these reports, to be assured that they're happening. You know, actually the results are very good, but you know, there will be things that need to be attended to and improved. And as Deborah Glassbrook said, there will be action plans in place and those will be monitored. And I imagine that we'll make sure that this is at least an annual report so you can see what progress is being made.
Lovely. No further indications. All happy to accept the recommendations. I feel like people want to go and watch the football. Is that the case? There's no football tonight. You're joking. Lovely. Thank you very much, everyone. Have a good night.